later. So as far as just micronutrient deficiencies,
Yeah.
I'm sure you see a lot of iron deficiency in women, right? Can we talk about what the symptoms for that and what you're seeing in your patients?
Yeah. Okay. So some of the common ones, I would say fatigue for the most part are going to be your common symptoms of iron deficiencies. Also along the lines with if you bruise really easily. So I would say that's probably even one of the more common ones. But when I see athletes that just, this is kind of the picture of what happens. So they're training through the season. Sometimes they will come in and they'll just say like, yeah, I'm just bruising a lot easier, something's kind of wonky there. But most of the time they'll start to see a decline in their training. So they'll start to see their numbers kind of get lower and lower, like they're just not recovering well. They're getting just tired, really, really severe fatigue, things like that just kind of come on fairly quickly. Because your body uses up stores. It really does store quite a bit of vitamins and minerals, including like B vitamins, things like that. It stores up a lot of that. And then it just takes a while before if you're still not getting it in through your diet and lifestyle and your environment, then it will use up those stores. And then once it has, it just drops. So oftentimes patients will come in and they'll say like, I just am getting more and more and more and more tired. The problem though, is that you have to determine if we're looking at something like chronic fatigue syndrome, or if we're looking at something like an iron deficiency, stuff like that. So those are your most common things with iron. And then there are some people who genetically just happen to not just absorb or use iron appropriately. So there's some factors there too that, and then they all tie into symptoms. So yeah.
Right. Exactly. I feel like iron is something we should talk about a little bit more, because women start to lose that aerobic capacity. And we know that iron is carrying hemoglobin, which is our oxygen to our red blood cells. And so, so you see women that are losing performance, they're trying to work out harder. Maybe they're not getting the same benefits. And that's like, okay, something might be going on here. And so what kind of levels, for anyone who knows the levels, like what kind of levels would you deem, adequate, and some that you deem deficient?
For iron specifically, I'm going to say that this one actually does depend on the lab that you run. So I can give you numbers, but it's more, let me go with this. There are optimal levels usually within the normal range. And so when let's say you go into your doctor and you say, hey, I need you to run a lab. If you are specifically looking because of fatigue and that decrease in aerobic capacity and all of that, there are two that you want to really make sure you look at. You want to make sure you get iron. And then I also want you to get them to run a vitamin B12 serum test. Nice. For two reasons. One, so iron is, as you mentioned, you have to have it in order for, you have to have it. And women in particularly, you will lose a lot of it. This is why it's so classically an issue with women, is because of the cycles. So you lose blood. And also I think I see this a lot in people who do not get it enough from their diet. So if I'm working with a vegetarian or a vegan athlete, there's a lot of things that I have to do if they're just not wanting to eat red meat. And I have no qualms either way. You do you, whatever is important, great. But let me help you.
Carnivore, vegetarian.
But let me help you make sure that everything makes sense. Now, the reason why I want you to do vitamin B12 is because when there's a article that we can link later, but vitamin B12 can also have anemias that are associated with it, and it can change the way your red blood cells function. So vitamin B12 may help you have a better oxygen capacity if you have enough of it. And so and also may help you have a little bit more hemoglobin synthesis too. So again, if you see something like an iron deficiency, I kind of want to know more. Like why? Are there some other components that go along with it? Yeah. So, and there's more to talk about that as far as the why goes too. But does that answer that question?
Yeah, for sure. I think it's not just a deficiency in iron. It's like, why are you deficient in iron? Maybe it's the B12. Maybe it's some other factors. Maybe you're stressed. Maybe you're depleting your micronutrient reserves because of chronic cortisol.
Right. Yes.
All those things. And so I guess just to simplify, if you had an iron deficiency, first step would maybe be eat some foods that are high in iron, right? If you're vegetarian, you might supplement with an iron, maybe.
Yeah. So a couple things. Iron supplements are awesome for getting your levels back up to where you want them to be. What you will often find is when your doctor says, okay, you've been iron deficient. Well, this is what they should say, I should say, is that when you start taking the iron supplement, you'll only take it for a certain amount of time. And then you're going to stop taking it, because once you've got your levels back up to the proper level, you should be okay. Just as you mentioned, every once in a while, something odd happens in the physiology. So sometimes you're maybe more stressed than others, or maybe in your training cycle, you just required a lot more of different types of vitamins and minerals, and you didn't get them for whatever reason. And so usually people don't need to be just on this perpetual iron supplement all the time. That's actually, I would say, kind of a misuse of iron supplements, unless you are in a situation where you just can't eat meat or don't eat meat. That would be another area. But also keeping in mind that there are some, types of foods that you can get vitamins and minerals from, like that certain types of vegetables that can bring those on too. But again, meat is your best source.
For sure.
Yeah.
That's awesome. I love it. Test, don't guess. Find
Don't you know?